Women's health has actually changed fairly dramatically for our system over the past 10 years. And, these changes may not be obvious to the outside observer, but, first and foremost, we are now a healthcare system. And so with our system really coming together over the past 10 years, it really has allowed for each of our hospitals to focus on the things that they do best.
Care has evolved over these last 2 decades that I have been at Rochester General in many, many ways. In years past, it used to be all medical. The nurses and the doctors and the families were never really allowed to get close. All that has completely changed. We want families to really be our partners. We are taking care of their baby, and so we want them to be directly involved, no matter how small and how fragile the baby is. Babies need nice, quiet, gentle space, especially when they're sick. Even normal, healthy babies do better in a quieter environment. Having that nice, soothing environment is a quantum leap in the care that we are providing. It's a big, big improvement. We are also able to take care of smaller preemies, and for those babies, it is even more essential.
The new facility really makes it much easier for our moms and dads to be present during the recovery of their newborn in an individual space that was not available previously. And we know that it is vitally important for that bonding to occur during the early newborn time period to allow for the best recovery, not only for mom, but also for the newborn.
So the new rooms have very specific designs as related to mom and baby to keep them healthy, happy, and safe. The mom's room is completely equipped with all the safety features that she needs in case there's any emergencies. The infant has a warmer and bassinet in order to provide physicians a space to do examinations while keeping the baby warm. There's also a sink that's specially designed for the infant to give infant baths on, so it's a little bit sloped in order to provide a safe environment to do that. And all the bathrooms are much larger than we currently have in the old space and provide the added safety feature of no lips or anything that the mom could trip over in order to getting in and out of the shower. It's just all one flat surface, so it's awesome.
First and foremost, what they will find is that the room is bigger. The aesthetic is much more modern. But very importantly, within each room, there will be a couch. There will be a sleeper sofa that they can sleep on to be present with their partner during the entirety of their partner's stay. And there will be plenty of room for their newborn within the room and for family members to come and visit.
I think having the entire floor dedicated is important because you can train all the staff to the mission. So the mission of providing safe, family-friendly care while supporting moms who are breastfeeding, and you can train every staff member that has contact with her is so important in making sure that mom's experience is exactly how she wants it to be.
The caring for the tiniest babies, they are the future of our community. Rochester General is a community hospital, and we pride ourselves in our ability to take care of not only our tiniest babies, but also older children and adults. Our nurses are absolutely wonderful. They walk these families through what is emotionally very, very taxing period in their lives.
As we grow our ability physically to care for newborns, we have greatly enhanced the training and our staffing for our newborn nurseries. Someone who truly feels that they are being well cared for is going to do better. And part of that is the environment that they're in.